Hello, good afternoon, everyone. We are looking at, we are continuing with renal physiology. So we are looking at renal clearance. Renal clearance. Okay. First, we'll start by defining what renal clearance is. Clearance is a general concept that describes the rate at which substances are removed from plasma. Okay, from blood. But here we are talking about plasma because plasma is the one that contains the dissolved substances. So therefore, body clearance means the total rate of removal of a substance by all organs. That is, hepatic clearance means the rate of removal by the liver. Renal clearance means the rate of removal by the kidneys. So the concept of renal clearance should be understood just from the beginning, okay? Because we apply it in many areas of renal physiology. Okay, so by definition, renal clearance is the volume of plasma which is completely cleared of a substance by the kidneys per unit time. Okay, let me repeat. Renal clearance is the volume of plasma completely cleared of a substance by the kidneys per unit time. So the higher the renal clearance, the more plasma that is cleared of the substance. Okay. And substances with the highest renal clearance may be completely removed on a single pass of blood through the kidneys. But substances with a lower renal clearance are not removed at all. So there's a formula that can be used to calculate clearance of specific substance. Okay, so this is the equation for renal clearance. Where C is clearance, the units are mils per minute. U is the urine concentration of a substance X. This substance X can be inulin, it can be creatinine, it can be urea, it can be sodium, it can be anything. It can also be glucose. And then V, this is the urine flow rate per minute. And then P, which is plasma, is a concentration of a substance in plasma. Okay, so this is a formula that you can use to find the clearance, the rate at which a particular substance is removed by the kidneys. Okay, when this substance is being removed, it passes into urine and it is excreted from the body. Okay, so renal clearance, from this we can say it's just the ratio of urinary excretion, okay, it's the ratio of urinary excretion to plasma concentration. Okay, so for a given plasma concentration, the renal clearance of the substance increase as the urinary excretion increases. Okay, so we need to understand the clearance of various substances, okay, like albumin. The renal clearance of albumin is approximately 0. It's approximately 0. What does that mean? It means this substance is not filtered across the glomerular capillaries. So you cannot find this substance in urine. And then also, the clearance for glucose in a normal healthy person, it is 0. Okay? But in people with diabetes mellitus, because one of the characteristic features of people with diabetes is hyperglycemia, so you find that there is a presence of glucose in urine. But in a normal healthy person, the renal clearance of glucose is 0. Why is it 0? Because glucose is filtered but it is completely reabsorbed into the bloodstream in the proximal convoluted tubules. Okay. But there are other substances like sodium, urea, phosphate, and chlorides. These, they have clearance that are higher than 0 because they are filtered and they are partially reabsorbed. Okay, but for glucose, it's 100% reabsorbed. Okay, that's why the clearance is 0. And then we have inulin. Okay, inulin is a fructose polymer. So meaning it's a carbohydrate, a complex carbohydrate. Okay, this one, inulin, is freely filtered across the glomerular capillaries, but it is neither reabsorbed nor secreted. Therefore, its clearance measures the glomerular filtration rate. So inulin, we are going to see that inulin has been used to assess the functions of the kidneys by measuring this parameter called the glomerular filtration rate. Okay, so inulin, the clearance is high. It is equivalent to the glomerular filtration rate. So what is that? The clearance of inulin in a normal healthy person is 120 mils per minute. Okay, 120 mils per minute. And then we have this substance. This substance is called PAH, or para-amino hippuric acid. This one, it has the highest clearance of all substances. Why? Because it is both filtered and secreted. Okay, so it has the highest clearance of all substances. That's why we are going to see that PAH, okay, PAH can be used to measure certain parameters, okay, of the kidneys. PAH can be used to measure parameters of the kidneys. Same applies with inulin. It can be used to measure the performance of the kidneys. Okay, so PAH, we are going to see, is used to measure renal plasma flow. Okay, so this is about clearance of various substances. Now there's this concept called the clearance ratio. The clearance ratio. If you remember, I said that inulin has a unique properties, and it is accordingly the only substances whose clearance is exactly equal to the glomerular filtration rate. Okay? So inulin is our standard because the clearance of inulin is equal to the glomerular filtration rate. Inulin is freely filtered across the glomerular capillaries, but once filtered, it is neither reabsorbed, it's not secreted. Okay? Therefore, the amount of inulin filtered will be exactly equal to the amount of inulin excreted. For this reason, inulin is a reference substance called the glomerular marker. Okay? Inulin is our glomerular marker. So the clearance of any substance can be compared with the clearance of what? Inulin. And this can be expressed in what we call the clearance ratio. This is what we are talking about, the clearance ratio. If you want, you can put 100% to convert the ratio into a percentage. Okay. So, let's say you have a substance X, and then that you find that the clearance ratio of this substance compared to inulin is 1. What does it mean? It means the clearance of X equals the clearance of inulin. So this substance must be a glomerular marker. It can be used as a glomerular marker because this substance is 100% filtered, but it cannot be absorbed, it cannot be secreted. Okay. What about if you find that this substance is less than 1? Okay, maybe we can say less than 1, like 0.9, which is 90%. It can be 0.8. It means the clearance of X is lower than the clearance of inulin. So either this substance is not filtered, that's what it means. It means it's not filtered, or it is filtered and subsequently reabsorbed. Okay. For example, albumin is not filtered, and the clearance of albumin is less than the clearance of inulin. Okay. Even also the clearance of sodium, the chlorides, the bicarbonate, the phosphates, urea, glucose, and amino acids are also less than the clearance of inulin, because these substances are filtered and then reabsorbed. But inulin, once it is filtered, it cannot be reabsorbed. Okay. And then this other ratio, what about if you find that substance X, when you compare to the clearance, is greater than 1? Okay. The clearance of X is higher than the clearance of inulin. Okay. So the substance is filtered and secreted. An example of substances whose clearance are higher than of that of inulin are organic acids and bases. And in some condition, you find that potassium, the clearance of potassium is usually higher than that of inulin. Okay, so this is the meaning of clearance ratio. That is, a substance is compared with the clearance of inulin, which is our reference substance, or the glomerular marker. Now, just to appreciate this equation, let's look at a sample equation. Let's look at the sample question. Okay. The question reads, in a 24-hour period, 1.44 liters of urine is collected from a man receiving an infusion of what? Inulin. In his urine, the inulin concentration is 150 milligrams per ml, and the sodium concentration is 200 milliequivalents per liter. But in his plasma concentration, or in his plasma, the inulin is 1 milligrams per ml, and the sodium is 140 milliequivalents per liter. The question is, what's the clearance ratio for sodium? And what is the significance of its value? What is the clearance ratio of sodium, and what is the significance of its value? So for this, try to solve this using this formula. Clearance is equal to U, okay? Clearance is equal to UP times the urine flow rate. So you find the clearance of sodium. When you do that, find also the clearance of inulin, and you find the ratio. Before you look at the answer, try to solve this question. So this is what you expect. V is urine volume per time, 1.44 liters of urine per 24 hours. Okay? Because V should be a flow rate. There should be time factor there. So 1.44 liters per 24 hours, when you convert it into mils per minute to just be 1 mil per minute. So you incorporate it in the equation. Clearance of sodium is equal to concentration of sodium in the urine, concentration of sodium in the plasma. When you bring all those parameters, you're supposed to find this, 1.43 mils per minute. Okay? Which means that sodium is being cleared out of the body by the kidneys Okay. About 1.4 mils per minute of sodium is being cleared by the kidney. But when you also calculate for inulin, you find that it is 150. So you can do the ratio. So this is what you find, 0.01 or 1%. So the clearance ratio here is lower than the what? It's lower than that of inulin. Okay. So there's a question, what is the significance of its value? Since the ratio for sodium, the clearance ratio for sodium is less than 1, it means that the clearance of sodium is lower than the clearance of inulin. So therefore, sodium is a substance cannot be filtered, or if it is filtered, it's subsequently reabsorbed. That's what it means, which is true. Sodium can be filtered and can also be reabsorbed. Okay. Let's look at another example. This example, I want you to solve it yourself using the same formula. Clearance of inulin can be used to calculate GFR, which is true. A woman who consents to renal studies in the Clinical Research Center is infused with inulin to measure for GFR. Over the course of the measurement, her urine flow rate is intentionally varied by having her drink large amounts of water. The plasma concentration of inulin is kept constant at 1 milligrams per ml with an infusion. However, the urine flow rate and plasma inulin concentration in urine before and after she drinks water are as follows. Okay. So, before she drinks water, and then after she drinks water. So, what's the effect of increase in urine flow on the woman's glomerular filtration rate? So this again, you need to play around with the equation. That equation which I introduced. Okay. And then when you incorporate the values, you can find the GFR before drinking water, which gives you 100 mils. GFR after drinking water, you find 100 mils. So, despite urine flow rate being markedly different in the two conditions, GFR was what? Absolutely constant. So, as the urine flow rate increased from 1 mils per minute to 5 mils per minute, the inulin concentration decreased from 100 milligrams per minute to 20 milligrams, a proportionate change. Okay, so to answer this question, what's the effect? There was no effect on the glomerular filtration rate in this woman. So this is about clearance, a very important concept. So from clearance, let's remember that the formula used to calculate clearance is this. Okay? And the clearance of inulin, when you calculate the clearance of inulin, it's the same as calculating the glomerular filtration rate, which is a single most important parameter in renal physiology. So we'll end here. Next, we'll look at how to measure renal plasma flow and renal blood flow.